Pregnancy symptoms are indicators that a woman may be carrying a child. Within the first 1 to 2 weeks of not getting their period, pregnant women may have morning sickness, weariness, sore breasts, and mild spotting. These symptoms, which may also include increased vaginal discharge, intermittent cramps, frequent urination, bloating, and mood changes, are usually brought on by elevated pregnancy hormone levels. Pregnancy symptoms vary from person to person. Some may have extreme morning sickness, while others may have no physical changes at all, leaving their pregnancy mysterious. When indications of pregnancy appear, people should contact a doctor right away for a pregnancy test and prenatal care. This will help to guarantee a safe pregnancy and help with adjusting to life as a new mother. In this video, we are going to tell you the 8 most early symptoms of pregnancy. So, watch the video from start to end. 1. Missed period. For people who get pregnant, missing their period is one of the very first signs of pregnancy. Human chorionic gonadotropin, or HCG, is a hormone that is generated in the placenta 8 to 10 days after conception to enable the fetus to grow. This occurs when fertilization between the egg and sperm is complete and the body begins manufacturing it. A brief cessation of menstruation follows as a result of the body ceasing to ovulate. Nonetheless, stress, hormone abnormalities, severe dieting, PMS syndrome, or overexercising can also contribute to missed periods. In order to identify the presence of the HCG hormone and validate the pregnancy, people who suspect pregnancy in this early stage should get tested. 2. Morning sickness, nausea, and vomiting. One of the most prevalent symptoms experienced by most pregnant women is morning sickness, which typically appears 2 to 8 weeks after conception. It is one of the early indications and symptoms of pregnancy. The symptoms of morning sickness usually appear in the morning. However, some people may continue to have them throughout the day. They include headaches, dizziness, nausea, vomiting, and loss of appetite. By week 12 of pregnancy, morning sickness may go away, only to return in the final week before delivery. Extreme exhaustion, fainting, and dehydration can result from severe morning sickness, hyperemesis gravidarum, which can also produce nausea and vomiting. Severe morning sickness should be treated right away by a doctor so that they may be properly assessed. 3. Tender breasts, swollen breasts, or breast changes. 2 to 3 days after conception, the earliest indications and symptoms of pregnancy are tender breasts, swollen breasts, and breast alterations. The symptoms, which include breast tingling and a feeling of fullness, will resemble those encountered prior to menstruation. The bra will feel tighter as the breasts become larger. In addition, the skin around the nipple, called the areola, darkens, the breast skin tightens, and the blood vessels become more noticeable. Breast changes, enlarged breasts, or sensitive breasts, usually happen after pregnancy. The symptoms of breast alterations will progressively go away after 3 months as the body adjusts to the increased hormonal activity that comes with pregnancy. 4. Frequent urination. One of the early signs of pregnancy that can be identified after a missing period is frequent urine. Pregnancy causes the body to produce more blood and fluids to support the growing fetus. This puts more strain on the kidneys to filter more blood and eliminate waste items into the urine, which increases the frequency of urination. There's a chance that the pee will seem brown or orange in color. In addition, the uterus develops larger during pregnancy, placing pressure on the bladder and increasing the frequency of urine, especially at night. 5. Fatigue. One of the symptoms of pregnancy that can appear in the first week following conception is fatigue. Progesterone is produced in large quantities by the body during pregnancy in order to support the fetus's growth. Conversely, the elevated hormone can cause the metabolic process to slow down. Pregnant women feel more worn out and exhausted as a result of the body using more energy to pass food through their bodies. And they may also have cramping more frequently. However, anemia brought on by an iron shortage can also contribute to weariness and exhaustion. 6. Spotting, light vaginal bleeding. During the first trimester, spotting, also known as mild vaginal bleeding, is a sign and symptom of early pregnancy. Following fertilization, the embryo implants into the uterine wall, causing vaginal bleeding or spotting during pregnancy without the sensation of cramping or pain in the abdomen. But not all expectant mothers have this kind of spotting or mild vaginal bleeding. People who experience continuous bleeding and cramping in their abdomen may be miscarrying, have an ectopic pregnancy, or are bleeding out blood clots from the placenta of the unborn child, subchorionic hematoma. In order to assess the symptoms, it is imperative that you get medical help. 7. Vaginal discharge. A pregnancy sign and symptom known as vaginal discharge is brought on by an increase in estrogen in the body of the expectant mother. This leads to an excess of vaginal secretions, moisture, and the buildup of bacteria or vaginal yeast infection in the birth canal, which causes abnormally high vaginal discharge rather than menstruation. Transparent, odorless, cloudy white mucus that doesn't itch is what pregnancy vaginal discharge looks like. To rule out any symptoms, anyone with irregular vaginal discharge that is itchy, odorous, and/or irregular should see a physician. 8. Constipation. Constipation is a typical pregnancy sign and symptom that is brought on by the same hormone that causes bloating, elevated progesterone levels. This causes the body to slow down the motility of the digestive tract. Moreover, intestinal peristalsis is impacted by the uterus's extension in reaction to the baby's growth, which delays the passage of food or liquids through the digestive tract and can cause constipation or bloating. Pregnancy-related constipation can be reduced with increased water intake, high-fiber diets, and mild activity like yoga, swimming, or walking. Pregnant women who experience constipation should consult a doctor for a prescription of a laxative instead of self-medicating